Thank you, Kishore. So I welcome first speaker, Dr. Vijaykumar. It's my proud privilege and honor to introduce this personality to you all. Professor Dr. Vijaykumar is a very devoted, dynamic, and well-known personality in the field of veterinary medicine. He is working as a professor and head Veterinary University Peripheral Hospital, TANUVAS, Chennai. He has more than 22 years of experience of teaching, research, and extension. He has excellence in USG, critical care, cardiology, endoscopy examination, then imaging techniques. He worked as a PI and co-PI of various schemes and completed sponsored projects of more than 2 crores funded by Government of India and Department of Science and Technology and even NADP schemes and schemes from Government of Tamil Nadu. He has more than 150 research papers to his credit, published in national and international journals. He authored 5 books in veterinary science. He guided 4 MVC and 3 PhD students and 3 PG diploma in veterinary endoscopy. He attended various international and national conferences. He bestowed with many prestigious national and international awards, recognitions in his illustrious career. Specially mention ISVM Gold Medal for outstanding contribution in Canine medicine. Then Bruno Memorial Award for professional excellence in VVC, Alved Prize Medal for clinical medicine and therapeutics in MVC, and ISVM Young Scientist Award, and many more, that is CSIR SRF Fellowship for PhD, TANUVAS Best Clinician Award, and several Best Paper Presentation Awards to his credit. So his greatest contribution in establishment of advanced critical care and imaging at units of high standard in college. Then he standardized cardiac catheterization in dogs. He standardized the nasoendoscopic imaging of rumen reticulum in cattle. He developed in vitro models for skill development for UG and PG for the clinical procedures in dogs, and endoscopic evaluation of esophageal disease in cattle. These all technologies were highly appreciated. So with these accolades and fame, I welcome Dr. Vijaykumar, and I invite him to start his presentation. Dr. Vijaykumar, please.
Yes. Shall I share the screen, sir? Yeah.
Yes.
Very good evening to all. At the outset, I profusely thank Dr. Bikani sir, Associate Dean, PGIVS Akola, and Dr. Professor Sunil Wagmari and his team, who has taken a very good initiative in conducting this national training program on new horizons of canine disease diagnostics and therapeutics. So all credit goes to Bikani sir. Thank you very much for inviting me for presenting this topic. The topic today for me is on emergency and critical care management in dogs. Let me not elaborate too much on the theoretical point. Me being a practical things, let us go by case studies. The number one case which helped me in a lot of cases to overcome hurdles, especially in critical situations like where we get apnea. As a clinical presentation, all of a sudden the dog is brought as apnea, or during elective surgery, maybe a overhysterectomy or a pyometra, especially when you go with ketamine as the anesthetic. So all of a sudden the animal becomes apneic. So there becomes a problematic, you become nervous. So you have to do resuscitation along with oxygen therapy. Now, what type of resuscitation is the best and which is really fruitful? The best point is the Zhencheng point, what is called a GV26. The Zhencheng is the Chinese nomenclature. GV26 is the international nomenclature. So what is this? Zhencheng point or GV26 is the acupuncture point, which has a direct respiratory stimulus. So this is the point. So how to locate it? Let us see this. So this is this one, external nostrils. Now you draw a line on the ventral aspect connecting both the external nostril and another line along the filter. The point where it meets, that is what is called as GV26 point. So please take care. So the line passing along the ventral aspect of both the external nostril and the line along the philtrum where it joins is the GV26 or Zhencheng point. So what is the procedure? Take a tuberculin syringe needle or a needle which is more than 24 gauge. Insert the needle here perpendicularly, and you can either do to and fro, or you can do a clockwise rotation like this, 1, 2, 3, or like a screwing it. You can do it like a screwing 3 times. After the 3rd time, you pull out the tongue 2 to 3 times. To your surprise, you will find what is apneic. The animal regains the respiration. It is a wonderful magic, and it's a take-home lesson. Please follow it in all the cases where you find a problem.
Excuse me, Vijaykumar sir. Vijaykumar sir.
Yes.
Just a minute, sir. Some of the participants they are saying that the screen is not visible. Presentation
Shall
is
I
not
stop share and then start it? I'll stop share and then start it from the beginning.
Yes, sir. Yes, sir. Sure, sir. Sure.
Is it visible now, sir?
Is it visible, sir?
Yes, sir. Visible now. Visible.
All are able to see. Shall I proceed, sir?
Yes, sir. Please, sir. Please. Yes.
Okay. Thank you. Thank you so much. So maybe there is some always technological advancement. There is some error which needs to be rectified. Similarly, the apnea, when we encounter, this is the first case for the participant. Those who are not able to see, this is a recap. Very often we get apnea during clinical presentations. All of a sudden the owner dashes to your OP and then says the animal is apneic. Or when you're doing an elective surgery, maybe along with a group of youngsters who are eager to learn. So in that time, so the apnea is really embarrassing. So how to do that? So you can have a all resuscitation procedure with oxygen therapy. The best we have found out is the Zhencheng point, or what is called as GV26. Zhencheng is the Chinese nomenclature, and GV26 is the international nomenclatures for this acupuncture point. So this is a acupuncture point, and it has a direct respiratory stimulus. So when you activate this with the needle, you re-get the respirations. Now let us see how to locate this. So you have these external nostrils. Draw a line on the ventral aspect of the external nostril like this, and another line you draw it on the filter. The point of intersection, this point, is your GV26 or what is called as Zhencheng point. So what is the procedure? The procedure is you take a tuberculin or what is called insulin needle. To be very simple, you can take any needle which is more than 24 gauge needles. You can identify the needle is so thin. Insert the needle here perpendicularly, and then you can make a screwing type of rotation clockwise. 1, 2, 3. You do screwing type of this one, and then pull the tongue 2 times or 3 times. To your surprise, you will find the animal regains the respiration. So that is a beautiful point, which was very much encouraging during my practice, especially when you are dealing with the youngsters, to do this type of critical procedures. And yes, you can take this point, what you call as Gen Cheng or GV26. It is easy for me to remember. This is my name, GV, and 26 is our Republic Day. That is how I remember this is GV26 or Gen Cheng point. Next is the case number 2, where we get a distended abdomen. The animal reports the animal is having a distended abdomen, especially when the pet is left in the garden after dinner, where you got quite a huge space for the dog to run about. After feeding, it becomes restless. They want to notice restless and having a retching. Yes, by this time, most of the participants would have guessed what is the case. Exactly, this is the X-ray of the patient. You are right, it is gastric dilatation and volvulus. Sometimes it is a simple gastric dilatation, the early you detect, and sometimes it becomes very severe to become a volvulus. So there is a clockwise torsion of the stomach with pylorus coming up and over the fundus and the cardia. This is really emergency situations where you need to attend it earlier, as early as 30 minutes to 1 hour. Otherwise, the animal may collapse. The catchy clinical sign is your unproductive retching. Nothing comes out. The very characteristic sign. And sometimes you'll get bloated abdomen and the pulse goes down. Very weak pulse, tachycardia, and then panting literally, and the animal may go for a collapse. So these are the clinical signs. You may not find all the clinical signs in an animal, but the weak pulse, bloated abdomen, and animal going down, maybe with a history of a dinner or whatever it is, animal goes for exercise or runs about after feeding in a large breed dogs. So this is, identify this as a gastric dilatation volvulus. The important X-ray feature is a double bubble. The way to remember is Smurfs head. Now you have got a lot of movies where there is Smurfs part 1, Smurfs part 2 is there. If you see, it is easy to remember, or Popeye's arm. What are these features? This is the double bubble we get in an X-ray. This is the Popeye's arm. Those who are spending time with the children, so you know this Popeye, after taking spinach, so he develops the biceps like this. So like this, you get the double bubble. We call it as a Popeye's arm, or it's simply the Smurf's head. So it's an easy way to remember, to make it more lovely to teaching. So these two have come very recently. In those times when our teachers were maybe reading, so they are with double bubble only, and then Popeye's Smurf head, we have advantage to make the students remember what is double bubble and detect this gastric dilatation volvulus. Another catchy point, you take an ECG as soon as the case comes in, even before going for an X-ray, when you are going to prepare the X-ray, is this VPC. These are the normal ways. You see a VPC here, here, here. So what is VPC? It's a bizarre form of waves which is deviant from others. That is a ventricular premature complex. We call it as a VPC. Now you can see the VPC coming over here, appear. The moment you look VPC, that indicates myocardial ischemia has already set in. So now you can see as the VPC keeps on advancing, it goes for VT. That is a ventricular tachycardia, fibrillation, and literally there is no cardiac output. So when there is no cardiac output, you can understand what is the consequences. It is our primary duty to control this VPC or ventricular tachycardia to make the animal live. So what are the initial things which we are going to do? Simultaneously evaluating the animal. Decompress the stomach using a stomach tube. Many times you may not be able to pass, so you can use a trocar if you do not have the proper stomach tube or not experienced. Most important is the usage of fluids. You have to use shock dosage, 90 ml per kg per hour. And please take home, another important take home lesson is avoid hind limbs. As you know, there is a torsion and there is a deficiency in return of the blood to the general circulation. So there will be a poor perfusion. Whatever you administer is not going to help you. So always use forelimbs, cephalic vein or central vein will be the best. So after stabilizing or during stabilization, then the procedure will be a gastropexy. You can do that, but decompressing the stomach, doing a gastropexy is not the end. You need to monitor the animal, controlling the VPC, and the VPC should be abolished. Monitor the animal up to 24 to 48 hours. If the animal do not have VPC, then you can be safe that animal has recovered. Otherwise, a perfect gastropexy, if you are not looking into VPC, the animal go for a death. So because it is initiated and it becomes a sequence, animal dies. So for the initial dose, it is 2 to 4 milligram per kg IV. And then during your monitoring phase, you have to go for concentrate infusion of lignocaine, 25 to 50 microgram per kg per minute. What is this constant rate infusion? They hold the highlight of controlling GDV and some of the disease condition which we are going to see. It needs CRI, constant rate infusion. It goes based upon the formula. D is your dosage of the drug, W is weight, V is the volume, R is the rate. This is the constant factor. So you have to use this to calculate the drug, how much amount of drug to be infused into the ringer's lactor or dextrose normal saline. If you are tensed, please go for an online calculator. There are a lot of calculators available in Play Store. So these are the calculators you can select and then use it. Whichever is user friendly, that calculator you can download it and keep it in your mobile phone that you can apply. What it is going to ask, there are many things which are constant. So weight, you already know what is the weight of the animal. The dosage, just now we have seen for lignocaine, it is 25 to 50 microgram per kg per minute. You can give 25 here. And then the availability of the solution. What is the availability? Because it's a 0.2%, it is 20 milligram per ml. And what is the rate? After initial resuscitation, this is on constant rate infusion. So you can put it as 20 ml, taking as 10 ml per kg, and the rate. And what is the drops? Are you using a standard IV set, which delivers 16 to 20 drops per ml? You simply put calculate. This calculator will tell you how much ml of lignocaine has to be infused into the solution, which is available in the sachet, maybe a dextrose normal saline or a normal saline. It's very simple. And the only thing what you are supposed to know is the dosage of constant rate infusion. What is the dosage of lignocaine? In our case, is 25 to 50 microgram per kg per minute. And there are a lot of drugs available to be infused as CRI, which is available in the form of the table in any standard book or even in your net. Please download it and paste it in your clinic. So if you are very intelligent and daily looking into it, you can use those things, remember by heart, or you can simply paste it. Use the constant rate infusion calculator, and that will tell you what is the ml of diazepam or lignocaine to be infused into the sachet. Is it clear? So another take home important thing is your constant rate infusion, CRI. It has got very much implication if we need to attend emergency and critical care. So this is, you know, what is this cluster seizure or status epilepticus. So all these needs specific drugs, maybe a neurological part, the subsequent speaker, Dr. Sumedhi may be taking into it. I am just touching this constant rate infusion, where another application is your seizure. maybe you can use diazepam, midazolam, or propofol. What is given in your screen is the CRI dose. Okay, it is a CRI dose. Please use this in the formula or the calculator to get so much ml of the drug to be infused into the saline. The other part is your oxygen therapy, and then simultaneously take the blood to analyze what is the system which has caused the seizure, or the ultrasound scan or ECG or CT to specify the lesion or which is under disease. So these are the workout to be done. So the important point we have seen is the oxygen. Let us see how the oxygen supplementation has to be done. A primary part being hypoxemia and other conditions. So as we have discussed, it can be the anemia, respiratory distress, sepsis, hypothermia, pleural space disease, CHF, a shock, pulmonary contusions, hypertension or seizures, and head trauma. So these are the conditions which needs oxygen therapy. So and that we are going to see the oxygen. Now there are different types of cylinders which we will be having either as a movable cylinders or a centralized oxygen supply. This is a D-type cylinder which is attached to the gauge and then goes with a pipe which is a centralized oxygen supply. And then here you have got a spanner to open the cylinder, and there is a flow regulator which has got a knob. This yellow color is a centralized oxygen supply. It goes through the humidifier and then goes, here is the flow control, and then here it goes to the pipe. This pipe we are going to attach to the patient. This is the humidifier because the oxygen should not dry up the nasal passage. That is why we are dipping into the water to make it humidified and does not dry up the respiratory tract. And once you turn this, we can fix up the rate. Usual rate for the dogs is 4 liters per minute, so that you can turn it up. Now, this is a simple D-type cylinder. Opening it, you will see the pressure here in the pressure gauge. This is the flow regulator, and which once you have opened the cylinder, which will be seen by appearance of bubbles here. And you can see the flow rate by the float. This float will tell you what is the flow rate. So now you get convinced that this is the appearance of the bubble. Reverse is also true. When the oxygen therapy is over, see that the cylinder is closed by using this spanner. The bubble should disappear. So that is the best way to assess so that oxygen is conserved. Now that is the way to operate it. Now let us see how to deliver the oxygen to our patients. This is, we can call it as a hood or whatever, the chamber. So you can introduce the head through this side or this side. So if it is a large dog, we can put only the head, so the animal gets the oxygen through this pipe. Or if it is a puppy, you can put the entire puppy inside. That becomes a chamber. Or you can simply give it by a flow by oxygen if the animal is not accommodative for your catheter, or maybe a Rottweiler which is very ferocious, not allowing you, you can go by flow by oxygen. This is the nasal prong which you have seen very commonly used in human, and the same thing can also be placed in the nostril in case of the dogs, or the face mask, what you use it in human. And most applicable is this type of mask, which we will be using it for induction of anesthesia or other things. This is very useful for our patients, mask. Or you can also follow the other method, what is called as intranasal administration of oxygen. So what is this? You administer through the catheter. So the catheter is deep inside the nasal cavity. So wastage of oxygen is slightly minimized. So for that, what is the procedure? You can take this the catheter, or what is called infant feeding tube, measure it from inner canthosaphy. This is the eye. From here to the rhinoceros, or what is called the external mass, you can measure. So this is the length, and kindly mark it on the infant feeding tube with a permanent marker. Don't do it with a whiteboard marker, permanent marker. After marking it, now you can spray lignocaine spray, or you can use a lignocaine jelly, and then pass the catheter along the ventral meatus. The holding of the tube is only with the thumb and index finger. It goes smoothly. If it is in the ventral meatus, the catheter passes smoothly. Pass it up to the mark. Here, there is a mark, so it passes up to the mark. After that, you flex it, put a stay suture here. Again, bring the catheter here in between the eyes or in the forehead. You can put another stay suture. Again, I am putting, this is the mark. Bend it, put a stay suture here. Again, bring the catheter here in the forehead. You can put a stay suture so that the animal do not disturb, and you can supply to the oxygen source. This is called as intranasal method of administration of oxygen. Next is intrapharyngeal administration. Still the catheter goes into the deeper area, what is called a pharynx. So you have got still more advantage of more oxygen being administered to the animal. So now you have to need the location. Here, this is called as the vertical rami, and this is the horizontal rami of the mandible. This is vertical, this is horizontal. So you need to measure from the vertical rami of the mandible to the nostril, external nostril. Previously, we are measuring from the inner canthus of the eye to the nostril for the intranasal. Now, for intrapharyngeal administration, from the vertical rami to the nostril. So once you measure, then you mark it on the catheter and then spray. The other procedure or same as intranasal. Spray it, pass the catheter on the ventral meatus. Then once it reaches the mark, and then bend it, put a stay suture, and again bring it in between the things on the forehead, put a stay suture. This is the procedure what is called as intrapharyngeal administration. There is another method, what is called as intratracheal, which is more important. So use the endotracheal tube. Use the endotracheal tube, and then you can use the ambu bag. On the other side of the ambu bag, you can attach the source, or you can put it on a ventilator. So these are the various ways and means where you can administer oxygen. Having known what is the usefulness, you should also know what is this oxygen cylinder. And then there are a variety of cylinders available in the market. And what is given as A, B, C, D, these are the older nomenclatures. Now, what is given below is a newer nomenclature. Please understand this one because this is needed. This is the older nomenclature and this is the new one. And please note the capacity of each cylinder. So why we need to know the capacity of the cylinder? Because while starting important resuscitative procedures or while starting the therapy, you should know for how many minutes my cylinder will last. So that is given by the formula. T is the time, K is the constant, and P is the pressure gauge, or is the safety. Usually it is 200 psi. Flow rate. This flow rate is decided by you. Previously we have discussed it is 4 liters per minute. Now you still have a difficulty in remembering the formula. Please use Play Stores and you can use this many type of calculators. Then what it is going to ask? This is a simple calculator which I have downloaded. So it is going to ask pressure gauge, which you have seen here in the pressure gauge, that you incorporate here. And flow rate is by the flow rate which you are going to decide 4 liters per minute. And that you incorporate here. Press calculate. It will tell my cylinder will last for 70 minutes. So this will give an approximate idea whether I have to start with a new cylinder or the cylinder which I have started using can suffice the present procedure. Now this is way it in another type of formula. It comes like this. First choose the cylinder and then a D type or whatever type, that will choose the constant and put the inflow liters per minute and the gauge pressure. You put a calculate, then it will give the 70 minutes. So that is the different calculator which is going to give, and whatever calculator you use, it is going to use the same formula and it gives the minutes. Now we have got recently, because of COVID, now you may be knowing oxygen generator or a concentrate which use aluminum silicate and then removes of this nitrogen, and what is remaining from the atmosphere is your oxygen. So just concentrates the oxygen which is available in our atmospheric air, that is being built up in 2 types of gas chambers or maybe cylinders that alternately pushes up to give the oxygen. But remember, this oxygen is useful because there is no chance of getting it exhausted. So you can use up to 5 to 6 liters depending upon the manufacturer. Sometimes it goes 8 to 10 liters. But these do not have enough pressure to be used in ventilator or anesthetic procedures, for which you need to have a cylinders. So the oxygen generator or concentrator will be of utmost use in an emergency setup. When you need to go for a ventilator or maybe anesthetic procedures, because it needs to carry up the anesthetic upon a pressure. So you need an oxygen cylinder. Now coming on to the next case, interesting case, because we get a lot of cases like this, accidental ingestion of poisonous material or anything like that. You know, it is initially by stabilization, by fluid therapy, the oxygen which we have discussed, and specific antidote if you have that known what is the intoxicated material, or maybe a universal antidote you can use. The most important procedure you can do it in emergency setting is your gastric lavage. So we get OPC poisoning, which is one of the very common. That's why I included this as a 4A case. So where you get salivation, miosis, urination, vomiting, colic. Nicotine signs may be fasciculation, weakness, and the other part may be seizure. So what are the important things which we'll be managing that I've highlighted, taking only OPC into consideration, and take the atropine at 0.2 to 2 milligram per kg every 3 to 4 hours, or depending upon the clinical signs improve. We will call it as atropinization. So what is miosis become dilated. So you can give up to that. Nicotinic signs can be managed by diazepam. Still, if you think there is a seizure, you can go for CRI. And the use of TANUVAS. So what is called as cholinesterase reactivating oxygen, this has to be used as early as 24 hours, because as the aging occurs, you may not be able to reactivate. So use it at the dosage of 20 to 50 milligram per kg, 5% solution as a slow IV. And then you can use activated charcoal, 1:5 ratio, 1 to 2 gram per kg, use as a slurry mixed with water, and then you can administer as a, after you remove the content which has ingested. The last dose you can use activated charcoal. Now we are going to see that how we are going to put the charcoal in an intoxicated animal. So this gastric intubation is a procedure. So to introduce the stomach tube into an animal, as we have discussed in GDV, gastric intubation will be able to relieve the pressure as well as the content and the lavage. The other procedure or in which it is going to be useful, the other condition is your intoxication. Okay, so the gastric intubation or the lavage, the main advantage in emergency setup is GDV or poison. If it is a conscious animal, then you can put this tape and then tie it up like this, pass the stomach tube through this. If it is a unconscious patient or oppressed, you can use the tube like this. You please measure the stomach tube from the last rib to the ramoris. Okay, so you measure from here and then kindly make a mark using a permanent marker on the tube, and then put KY jelly or whatever lignogen jelly what is available here, lubricate the tube. If you do not have, at least use a saline. Then you can introduce the tube into the stomach through the esophagus. You need not worry, because already there is a ET tube, endotracheal tube into the trachea. There is no way that it can go into the trachea. So now we have introduced the tube up to this mark. So for any gastric intubation, please remember or take home lesson is that you have to put ET tube. Putting an ET tube is a must. Then only you can put the stomach tube, especially in case of intoxicated animal. Okay, so up to the mark you introduce, then you can attach. This is the end part of it. You have to attach to the bulb. This is the bulb. From the bulb, there is extension tubing which ends the funnel. Now this funnel is kept ready. We can pour water initially there will be a problem to accommodate the water because there is an airlock inside the tube. Because there is air, so the water may not move. So there is a bulb. Please press the bulb once, so the water goes automatically inside. Keep pouring the water. Then afterwards, you can invert the tube and remove the funnel, and then the water comes out through siphoning method. So this is the gastric lavage. Now you have to repeat the cycle. Keep on doing that. Pour the water through the funnel into the stomach and siphon it out. So keep on repeating this cycle till the returning fluid is as clear as what you have infused. So then the last one, after when the returning fluid is very clear, the last sitting, you mix this activated charcoal, which you have taken as 1 gram or 1 to 2 gram per kg, mix it with the water as a slurry. Then you can put it through the stomach tube, keep it there, because this activated charcoal will absorb what is left inside the stomach. So preventing the further absorption. Then do not forget to use a specific antidote in that types of poisons. I hope this procedure is a very simple procedure. And then the stomach tube is costing only 210 rupees, available everywhere in the pharmacy. If you go for a standard the shop which deals with all the surgical item, you'll get it. It is only 210 rupees. You can use it. Now, only contraindication for this is do not use this gastric lavage if the intoxication is zinc phosphate. That is the rodenticide, because it goes with gas fumes, so which is very toxic to human also. So don't use that. So if you are going to use, only the cautionary note is you have to use adequate precaution of wearing mask, and then see that the gas do not get inhaled. You do not get the inhalation of the gas. So the only contraindications, do not use this lavage without adequate precaution if the material ingested is zinc phosphate, which is a rodenticide. Now I am giving this video with the sound. The cat is extremely distressed. You can see the other cat also. Now, in a clinical setting, the cat or the dog, more especially is the cat, will not be sitting on the table. Either it jumps into the owner's lap or into the basket or the bag which the owner is having, or it may be going, unless you are very friendly and then talking with the cat. In a new environmental setting, it usually jumps. Now you can see the cat is there, stands still with severe distress. That shows how much it is being compromised. So the respiration is called as paradoxical respiration. Chest comes in, abdomen goes out. Abdomen comes in, chest goes out. So this type of alternate type of thing we called as paradoxical respiration. Yes, the participants, many of the practitioners would have now diagnosed what is this condition. Correct, you are correct. The condition is pleural effusion, and many of the practitioners by this time would have taken the material needed to drain the fluid. Okay, so what is this procedure? This thoracocentesis material, very simple, we'll discuss now. It is highly effective for the management of hemothorax, chylothorax, pylothorax, or maybe neoplastic effusion, or the fluid because of right-sided congestive heart failure, and also in management of pneumothorax. Very often you get it in case of cat. So what is the site? The site is the 7th intercostal space. You always count from the beginning, 13, 12, 11, 10, 9, 8. Once you start counting 8, then you are in the 7th intercostal space. Count from beginning 8, once that is in 7th intercostal space, and then you divide the chest into 3. So dorsal, middle, and then ventral. So you have to introduce the needle What is the needle you are going to select? You are going to select is a 20 gauge butterfly needle. So introduce the needle on the ventral aspect of the 7th intercostal space, left side or right side. After proper usage of surgical spirit or povidone iodine, you can introduce at a 90-degree angle, in the sense it is perpendicular to the ribs when you are going to enter, and after entering you are going to direct the butterfly needle or whatever the needle downwards parallel to the ribs. You will see immediately the flow of fluid into the butterfly needle, and that gets drained out. So how much quantity I should remove? You remove as much quantity as much possible. Okay. So what if I am not getting a fluid? Try it another time. You don't try more than 3 times. So you can go it on the right side. If you are doing on left, if you are on right side, if you are left, go it on the right side. Change the side and do not attempt and then make the owners embarrassing and you put in a difficult situation. So this is the fluid, and the color of the fluid and the cytology and the protein will tell you to progress about the disease and also on the prognosis and the type of treatment which you are supposed to adopt. And this is interesting, the same thing, pleural effusion, which is a chyle here, and this is a ordinary serous fluid. The important is the technique. Materials are very simple, available everywhere, nook and corner of the country. What is a material? A simple needle or a butterfly needle here, a 3-way adapter, a syringe, preferably 5 ml, which you can do it very repeatedly, and an extension tubing that ends in a kidney tray or a ball. So you attach like this, very simple procedure. So first is like this, and then you consider this needle is inside the animal. Now first procedure is pulling this or withdrawing the plunger of the syringe. Once you do it, it comes like this from here to here. Next part is you are going to turn this knob this side. Now you can see what is the connecting from the animal to the syringe. Now after turning, now the connection is from the syringe to the extension tube. So this is the knob. So now you can see after the knob is turned to facilitate the drainage of the fluid from the syringe to the extension tubing, you can push the plunger. So the fluid, what is there in the plunger, in the syringe, will go into the extension tube. So now from here, now you are going to change the knob so that it comes like this. Now re-establishing the connection from the animal to the syringe. Now once that is there, now you can do the withdrawal of the plunger so that it comes like this, collecting the fluid or whatever material from the animal to the syringe. Now you keep on repeating this, so it becomes very important emergency clinical procedures, medical procedures. Now this video, just listen. So collecting material from here, changing the knob, pushing it, going to the extension. Keep on doing it. So you can quickly remove the fluid. So this procedure, you keep practicing when you don't have case in your clinic. Then it becomes a very important skill that you have developed over a period of time. What you need is only patience and then consistency. So this is an important procedure. Please take it home and start practicing from now onwards. You will be successful in the first case itself on day 1. Because it's a simple procedure and you can practice. This is the fluid we have collected, and see the cat, and the owner is very much happy. Now this is a distressed cat and this is the cat. So now how it becomes inquisitive. See, it becomes alert and it is interested in the environment. Previously it was very much distressed. So this type of dramatic improvement has to be done by doing thoracocentesis. This helps in saving the animal. And the collected material needs to be analyzed, animal has to be stabilized, and the type of antibiotic or other things will be dictated by the material you have collected, and other procedures, maybe a scan or X-ray, which we are going to do it afterwards. Don't be in a heroic way to document the pleural effusion by taking X-ray. You will get a beautiful X-ray, but animal will not be there. So it will be available for your postmortem. So stabilize the animal always by thoracocentesis. Then you can go for an X-ray and other procedures. Even if you want to do ultrasound, do it by keeping the animal in the client's lap or hand, in whatever way the cat or the dog is very comfortable without putting them under stress. So next case is this type of dog where it is highly distressed and not in a position to lie down. And this case has got pleural effusion as well as pericardial effusion. You can see another case also. So which has got fluid accumulation in peritoneum, pleural effusion and pericardial effusion. This is because it has got both mitral and tricuspid insufficiency, which has been assessed through echo. So the procedure you can do is pericardiocentesis. After confirming with an echo, you can do. So the site is the fourth intercostal space, and the other procedure is same as your tapping of pleural effusion. The site alone changes the fourth intercostal space. Always do pericardial drainage, pericardiocentesis with the ECG guidance. So if you are going to touch, then there will be an arrhythmia. So always do it with the ECG guidance. For the next case, we can see this is a highly distended abdomen. We need to stabilize the animal and then explore what is interesting inside the abdomen. So for which we need to do abdominocentesis with a profile of blood and serum to rule out the organ system failure or dysfunctions, a catch-up of ECG, X-ray, ultrasound, and echo to find out the exact etiology. Now, this abdominocentesis will help in diagnosis as well as the management of hemoabdomen, uroabdomen, identify whether there's a peritonitis or neoplastic effusions. What is the site? The site is from xiphoid to umbilicus. That is the area, but the exact point of insertion is 1 inch on either side of linea alba. This is the landmark. This is the site, 1 inch on either side. Xiphoid. Yeah, so it is on either side, 1, 2, and again third and fourth. We have got 4 points, what you call as a 4-quadrant technique. And then do this type of aseptic precautions. And then you can insert the needle and then collect it. Collect it in all the 4 quadrants. If you are not able to collect in all the 4 quadrants, then you can declare that as you do not get peritoneal fluid. In a case which we have seen, so you are definite to get in the first prick itself. So that is the landmark in getting it and how to introduce the needle in collecting the ascitic fluid or peritoneal fluid. So while discussing about pleural effusion, we have been advocating, please remove as much amount of fluid that you can do it. But as far as the abdominocentesis is concerned, in which case we have seen like this, remove only 2 ml to 5 ml or what is needed for your diagnostic purpose. Abdominocentesis is always a diagnostic criteria, and you do not remove the fluid. After it is going to reaccumulate it and putting the animal under distress, unless the accumulated fluid is going to cause embarrassment, respiratory embarrassment, animal is dyspneic. In those conditions only you remove the fluid till the animal becomes comfort. Because this is what we have seen when you put that we have removed 10 ml of abdominal fluid from a dog, then immediately in WhatsApp comes, I have removed 50 ml. Then another person puts, I have removed 100 ml. Then the third person puts, I have removed 500 ml. There is no fancy in indicating the ml of fluid. Please understand and follow that it requires only 5 ml for diagnostic purpose, as far as the peritoneal fluid is concerned. I hope most of the practitioners will agree with this. And this is also a diagnostic purpose. See, this is indiscriminate usage of NaCd, which has caused a stomach ulcer ultimately ending in peritonitis in a small puppy like this. So another take-home lesson: please use judicious use of NSAID with the proper gastric mucosal protectants. Coming on to the analysis, you take up the fluid. The more important kindly concentrate on specific gravity, protein, cells. So these three things you have to focus, which helps us to categorize the transitate, exudate, and modified transitate, thereby hitting the cause. This is a refractometer, please, which will be highly useful to identify the TP or total protein and the specific gravity of the collected fluid. So which will give a rough guidance to proceed the organ under suspicion. And we have seen a seizure or other things. So in a clinical entirety of an emergency and critical care, blood glucose estimate is an important parameter. Don't forget to estimate blood glucose, and then keep everything ready. And then it asks for, keep the glucometer ready. It asks for the bed. Once you are dipping in, then it may take 4 or 5 seconds and immediately read it and document and keep it ready, because even hypoglycemia can cause seizures. So that is a criteria. Or so you need to rule out whether it is having diabetes or not. So in a clinical setting of a critical care and emergency, estimation of glucose is also an important parameter. The highlight is putting onto the catheter, either peripheral or central, because we can interact with the patient only through the IV setup. So it is with the crystalloid or colloid, usage of blood products or intravenous drugs, or to maintain the anesthesia. Preferably use cephalic or maybe saphenous. Always go from as caudal as possible. So maybe from here you proceed. Don't puncture it up here and then call your boss or maybe a senior expert. So as soon as you don't being a junior vet in the clinic, don't puncture it here. Start from as caudal as possible, from here, here. Then you can go, because the vein is available. If it comes for a fluid therapy for 7 or 14 days in case of some blood protozoan disease. So unless you put a catheter, so it may not be available. So don't puncture it up. Even if you puncture it only one leg. Don't puncture all the 4 legs and then call your senior to do a venipuncture. I don't think he's a god to do the venipuncture. Even if it does, there will be a swelling. So try it 1 or 2 times and then call your seniors to do the procedures and then do the precautions. So clipping the hairs and then do the aseptic precautions, and then you can use the Venflon at an angle of 45 degrees, introduce it. Once it is inside the vein, then you will see the flash of blood here. Withdraw the needle a little bit and then push the catheter inside. Spread the wings of the catheter and then bandage it. And then you can attach the IV set or put a cap. So secure the things for the usage of fluids or blood products for 2 or 3 days. If it is for this one, you can use fluids. Once it is over, recap it and then flush it with the fluid or heparin. So this is a peripheral vein with the cephalic as the indication. You can also choose a saphenous vein, same as this. Palpate the vein and then introduce the catheter. When there is a flash of blood, and then push the catheter and then spread the wings and then secure it. The other part is central vein catheterization, which is more important when you are going to do it for a long term, or especially on parenteral nutrition or the measurement of central venous pressure. The contraindications is very little, especially coagulopathies. As far as the central vein is concerned, so you have to heparinize all the materials which you are going to use. This is heparin, the hypodermic needle, and this is a dual lumen catheter. You can use single lumen or double lumen or triple lumen depending upon the need for it. Heparinize and heparinize the dilator. Then you shave the area, keep it ready, disinfect. Now all these dogs, now we are exposing it. There is no drape. If I cover the dog with the drape, you may not know where exactly the needle is inserted. That's why it is without drape. So now you introduce the needle. It is in the jugular vein. You get the flow, the blood. Now through the needle, you are going to introduce the J wire, which is an important step. Introduce the J wire. J wire goes through the needle into the jugular vein. Now this is the J wire and this is the needle. Now keeping the J wire inside the jugular vein, now you can remove the needle. Once the needle is removed, through the wire, you introduce the French dilator. This is because we are going to introduce the dilator so that the vein is little bit dilated and the subcutaneous tissue, all these are dilated to accommodate the catheter. The French dilator is stiff, whereas the catheter is slim and flimsy, so you cannot push it very rigidly. So that's why French dilator is used. And then after dilating it, again remove the French dilator, keeping the wire inside the jugular vein. Then again through the wire, you introduce the catheter. And finally, when the blood appears in the catheter, you remove the wire. Secure it with a stay suture and then put on a hip panel. This is for the central vein. Either you can use it for dialysis or for a long-term administration of fluid. This setup is also used for CVP, which is central venous pressure measurement, which is very crucial in a critical setup. Most commonly is used in human as well as in dogs. Now, simple to know how the manometer works, you need to know this is a manometer, simple manometer, which costs you about only 120 rupees. So this is the manometer. Now, from the IV fluid, it connected to this one. And then from here, one tube goes and connected to the catheter, which you have fixed in the central vein. So this is set up. Now let us see how it is being set up. Now, first you connect the fluid into this, keeping the knob like this, so that the normal saline goes and the bead rises here to see that there is no air bubble here. Next, you turn the knob like this so that there is a connection from the saline reservoir to the IV extension tubing that connects to the jugular vein. So there will be filling of the fluid up to the tip. Now, once this is set up, now we change the knob to this, which connects the fluid from the animal to the manometer. Now the manometer, what is the reading will be given by the bead here, red color bead or the blue color bead that will be. Please measure in level with the heart. So keep it, then some amount of accommodation has to be done for the reading. If it is above it, then you have to subtract. So this will give the CVP in centimeters of water. This is normal, less indicates hypovolemic, just you can simply connect it. So for example, you turn like this, measure it. Once it is hypovolemic, you can keep like this, keep pumping the fluid. Then after half an hour, you turn it, measure it. If it has reached, you can stop the fluid. So this is a very simple, clinically available setup at the field condition to measure the hypovolemia. Okay, so once adequate setup of 7 to 10 centimeter of water is reached, then you can stop the fluid. This is an interesting case of case number 8. Immediately, many of you would have identified this case or yet another case. So which is due to this, which is very common in our area. This is a viper envenomation, snake envenomation, and highlight alone I will be telling because it's important. We use the anti-snake venom polyvalent. The catchy point is you have to use 20-minute whole blood clotting time. What is that 20-minute whole blood clotting time? Collect the blood in a tube like this, which do not have anticoagulant. Suppose you do not have a vacuum, use ordinary glass tube which do not have anticoagulant but dry. Collect the blood as soon as the animal has come. As soon as the animal has come with this type of swelling or light, collect the blood and keep it aside for 20 minutes. Okay, after 20 minutes, then you tip off the vacuum like this. If the blood goes like this freely, that means this is the case which needs anti-snake venom. If that has clotted, that particular animal do not require anti-snake venom. Why it is important? Because anti-snake venom available in the market is exclusively for anti-snake envenomation in case of human. That is a specific thing. So we are using that. So please be genuinely using this following the 20 minutes whole blood clotting time. This is the animal before and after. Now this is another in continuation of the case number 8. This is another strategy where the dog went outside into the grass field, returned and then fell down, become recommend, not responding, and become dyspneic. So on severe exploration, it's very difficult. If it is a hairy breed like German Shepherd, then you see the fang mark. Yes, you are correct. This is a type of cobra or crate innovation. You can start these things based upon your till the animal becomes improvement in the response, clinical response of activity and the respiration. So you have to start the antivenom. That is the difference. Is as far as the viper is concerned, kindly do the 20 minutes whole blood clotting time. If it is positive, you can go for anti-snake venom. If it is clotted, don't go for anti-snake. And case number 10, we get epistaxis. Epistaxis, many of you have been doing it excellently, but the take-home lesson is important. Any case of epistaxis comes to your clinic, which is very rush or in a OP, talk to the owner that this dog requires isolation. You go to a place where there is no other dog or public, keep the animal. It has to be kept unexcited without stress. If necessary, you can use xylazine and ACP. And tell the owner, re-emphasize that I will be attending this dog, but this dog requires relaxation, and then you can attend. If it is in a stressed environment, and more epistaxis will come. So you have to, the success is in ACP or xylazine, the animal becomes calm. Then you can, all the other things all you have been doing is routinely adrenaline spray or whatever commercial preparations are available, which makes the things clot immediately, or pressure things. Then you have got a sufficient time to explore whether it is because of trauma or hypothermia or because of blood protozoan disease or thrombocytopenia or neoplasm. These are the other differentials which you can do it later, but the idea is making the animal isolated. This is beautiful. This is what we get repeatedly. Animal is left in the car and the public, the client goes for a shopping and then comes back and then finds the animal is highly panting, high temperature, and then full of the whole seat of the car is wet with the saliva. And this is show we get here a lot of cases, high humidity, and sometimes in the kennel which is directly exposed to sunlight. So this is yet another case. So where you get panting, restless, and becomes recurrent, dehydrated. If the animal is left without treatment, it goes for the death. That is hypothermia. The highlight of hypothermia is your fluid therapy. Simplest method to treat is your physical methods of cooling. You have to do the water shower. Do the cool water, don't do cold water. COLD is contraindicated. And then gastric lavage and enema. This is another case where your gastric lavage is of use if possible, but simple fluid therapy and physical methods of cooling is most important in managing hypothermia. Another tip for hypothermia is as soon as the hypothermia goes for this type of panting, restlessness, definite it is to have a VPC. Please look for VPC or any arrhythmias and then respiratory distress. You can also go for oxygen therapy. Control and manage this VPC. Once you have managed, then you can save the animal. In case number 12, this is an interesting case where the animal was highly inquisitive and then took this bite, and ultimately this is a dog's chain. So you can use this bone cutter if it is an institute or you are using orthopedic materials or a set, you can do that. Or else a simple common sense of using an AXA blade with the AXA blade frame. You have to use it along with the AXA blade frame. Then the procedure is over within 3 to 4 minutes. If you are using only AXA blade, you will not be successful. See, it becomes very easy. Why I have put this case? In many a case of critical care, your common sense plays an important role. Be very cool, especially when the highly risky, critical and emergency case comes. You don't get tensed. Your pulse should be normal. You should be having a normal respiration and be relaxed. You be relaxed, then you can attend to any cases and apply common sense as much as possible. I think most of the cases will be successfully treated by you. Thank you. Over to Professor Sunil, sir.
Dr. Kishore. Sir, thank you very much.
Thank you very much, sir.
Yeah, thank you.
Yes, sir. Regarding some of the questions, I think only a few questions are there, sir.
Yeah, I'll just read it out if it is possible.
Yeah,
Can we use GV26 method for puppies? You can use for all the animals, but don't try for another human. Okay, so maybe your friend is sleeping in the cot. So the same technique, measure the things and then use the needle in this filter. No problem, it will bring back the respiration. You will get the slap from him also. So don't use it. You are authorized to do for animals. You can use for puppies also. Different in treatment of dehydration shock. I think this is a fluid therapy. One of the speakers is going to talk about it. So I have not covered. The important point in emergency and critical care management is fluid therapy. Sir has given this topic to another person. So I have saved the time in my presentation because only 1 hour is Sir has given. Anti-snake venom dosage, that is an important question. I should thank Dr. Vivek Vittal for asking this question because it varies. Anti-snake venom, we use normally 1 vial here in Tamil Nadu. Sometimes in Namakkal, we use 2 vials. It depends upon the area. Please have a surveillance where you are. Please ask your senior. Now we use only 1 vial here and that is able to neutralize it. But when we ask our friends at Northeast, they use 5 vials. This first starting dose is 5 vials. So that is because of the difference in the potentials of the snake. Okay, please ask your seniors and then you start your practice. So that is the dosage. So can we use enema for each stroke? Yes. First you do the fluid therapy and the physical methods of cooling, and then simultaneously you can use enema also. No, not only enema, gastric lavage also given. Adrenaline injection or atropine? Atropine is the best. I think most of the questions has been things, and I give way to the other speakers because 2 more speakers are there. I thank wholeheartedly our beloved Vikani sir and Professor Sunil Vagmari and his team who has done excellent work. So over to Dr. Sunil Vagmari because the people are waiting to listen to 2 more speakers. I should not take up the time.